How effective are sling procedures for bladder incontinence? How effective are sling procedures for bladder incontinence? This is a common question for those seeking solutions for stress urinary incontinence. Sling procedures are recognized as effective surgical treatments that can significantly improve bladder control for many individuals. They work by providing support to the urethra or bladder neck, which helps prevent urine leakage during activities that increase abdominal pressure, like coughing or exercising. When we look at the effectiveness and outcomes of these procedures, we find that for men who experience incontinence after prostate surgery, sling procedures can reduce urine leakage in about 69% of cases. Some men even achieve complete dryness. This improvement often leads to better patient satisfaction and enhanced quality of life, with serious complications being quite rare. In fact, sling procedures have shown effectiveness similar to that of artificial urinary sphincter implants in these cases. For women, various types of slings, including retropubic tension-free vaginal tape, transobturator tape, and pubovaginal slings, have demonstrated high long-term success rates. These rates often exceed 80 to 90% for the objective cure of stress urinary incontinence. Among synthetic slings, the retropubic tension-free vaginal tape and transobturator tape are preferred due to their balance of effectiveness and safety. Meanwhile, pubovaginal slings are often chosen by patients who prefer non-synthetic options. There are also mini slings, which are a less invasive alternative. These have shown comparable effectiveness to traditional mid-urethral slings over at least a 3-year follow-up, with similar rates of complications and the need for reoperations. While sling procedures are generally safe, they do carry some risks. These can include mesh erosion, pain, urinary tract infections, and the possibility of needing reoperation. The risk of mesh exposure tends to be higher with transobturator slings compared to retropubic slings, but overall, these risks remain relatively low. Proper patient selection, surgical technique, and specialized training are crucial to minimizing complications and optimizing outcomes. It is important to note that sling procedures may be less effective for patients with poor urethral function or complex pelvic floor issues. For instance, retropubic slings might be more successful than transobturator slings in women with urethral dysfunction due to their different mechanical support mechanisms. Sling surgery is usually considered when conservative treatments, such as pelvic floor exercises, lifestyle changes, or devices, do not adequately control stress urinary incontinence. The choice of sling type and surgical approach depends on individual patient factors, including anatomy, severity of incontinence, prior surgeries, and personal preferences. For patients with bladder cancer, particularly those who have undergone prostate or pelvic surgeries, sling procedures can be part of managing post-surgical incontinence. However, decisions regarding this should be individualized and made in consultation with urologic oncology and reconstructive specialists. In summary, sling procedures are a well-established and effective surgical option for managing stress urinary incontinence. They offer high rates of success and patient satisfaction. Their effectiveness and safety profile make them an important part of bladder health management, especially when conservative measures are insufficient. However, it is essential to have a personalized evaluation by healthcare professionals to determine the best surgical approach and to weigh the benefits against potential risks.